Sickle cell disease is a hereditary blood disorder that gets its name from the sickled or C-shaped red blood cells. Doctors say sickle cell is thought to have formed as a way for the human body to protect itself from certain diseases like malaria. It is most commonly found in people of African descent.
If you inherit from both parents the regular type of hemoglobin, then you have that, you don't have any problems. But if you inherit from both of your parents the sickle hemoglobin, then you'll have sickle cell disease.
The abnormal shape of the blood cells may interfere with the flow of blood and clog blood vessels. At that time, a painful attack, called a pain episode, may occur because the body tissues are deprived of oxygen.
Their red blood cells are aggregating at a point where the vasculature gets very small. And so as these cells go through the vasculature, some of them are sickled in shape, and those sickle shapes like to stick together. And when they begin to stick together, they clog up the flow of blood through the area.
20-year-old Sadiq Kansi has sickle cell disease and was recently hospitalized for 6 weeks due to a pain episode.
They put me in the ICU because I started off with just pain, and then when you lay there too long, your lungs, they get smaller and smaller. So then they had to put a breathing mask on me.
Patients are prescribed a number of different medications to help with pain management, but when it comes to treating the disease, there's only one approved drug.
Hydroxyurea, which seems to work by increasing the level of fetal hemoglobin, which normally is not produced, but if it's produced, it's kind of substitute for mutated hemoglobin and kind of lessen the symptoms.
Research is being done to find a cure. For the past 8 years, Drs. Lloyd Mitchell and Kareem Washington have been working on a sickle gene repair project that would decrease the sickling of red blood cells. They're rewriting the beta-globin gene, which is involved in causing sickle cell disease.
And we're trying to turn the beta-globin gene into the fetal version of beta-globin, which is called gamma-globin, which everyone made when they were a baby.
According to doctors, the higher the fetal hemoglobin, the less likely a patient is to have symptoms of sickle cell disease. In the United States, 100,000 people have sickle cell disease and 2 million others have the trait. The trait is the underlying carrier state of the disease in which you don't have any symptoms. Carriers of the trait can still have children with the disease or the trait. For Howard University's News Vision, I'm Jamai Harris.